Yes, so we're continuing our conversation on the vital signs of chapter 7. We've talked about the different methods of measuring your vital signs, including the temperature, the pulse, the respirations, the blood pressure, and now we have to look also at the fifth vital sign, which is referred to as pain. Now, pain is a very important vital sign. Why is it? Because it can have a lot of effects on your entire body. So it's very important that you assess for pain in different ways for different demographics. It is uncomfortable and is an individual experience. So we say pain is subjective. What it means is that it's the patient experience, their opinion. If everybody has a different perception of pain, some people have a high tolerance for pain while others have a low tolerance. So whatever the patient tells you pain is, that is what you have to document and report to your nurses. Your nurses should observe and report carefully since care plans are based on the reports. If there is certain pain on a certain part of an area, perhaps the joint it is affected and the resident has lost some ability to function independently, perhaps it is a time for an evaluation for physical therapy. So the nurse aide must ask questions to get accurate information. Pain is not a normal part of aging. I know many times we want to or think that as we get old, we should experience pain on a regular basis, but that is not the case. Pain is not a normal part of aging. So we have to evaluate it because I see too many older residents shying away from reporting pain because they don't want to be seen as less than, or they don't want to bother us, or they just don't want to report. But you can tell when a patient is experiencing pain, number one, by their increased pulse, the respiration, or their blood pressure. That may be a first indicator of pain. They may be nauseated, they may be vomiting, they may be withdrawn from eating. Some of their body features or expressions may tell you that they're experiencing pain, such as frowning, grinding teeth, uh, uh, rolling into a fetal position, or getting more agitated or restless. These could all be possible signs of pain. So we must assess, again, the patient in a holistic manner and evaluate everything and find the possible cause of pain. It is not our job to diagnose why or what's going to be done about it, but your job is primarily to observe and report these abnormal findings. Okay. So again, every person will uh, demonstrate pain in a different manner. So please be considerate, be empathetic, and report pain as you notice it. Now, pain can be measured in different ways. One of the common ways that we do is by using a numerical scale. This is called the Baker-Wong numerical scale. Now, we can use 1 to 5, 1 to 10. Uh, you can use this scale depending on the patient's abilities to understand. If you tell them 0 is zero pain and 10 is the worst possible pain you've experienced, okay? They may say, well, it may be a 5 or a 6, then that is what you document, okay? So this is a numerical scale. The other scale is we use the one with the faces. This is the Baker-Wong scale. So this is the one that we use for patients that may have be trouble maybe understanding the number scale, or they may have trouble pinpointing what number. You can use a face scale and tell them to point at the face that they most feel represents them at that particular moment. So the Baker-Wong scale or face scale is a very useful tool to evaluate pain on older residents or even younger people that are not able to understand the numerical scale. You will find some residents that are not able to voice any numerical or any phase scale. They will not be able to understand it. So for them, you will have to use special tools to be able to evaluate their pain. Okay, these are pain scales used for cognitive impairment. That means they're not unable to think or process. So what kind of scale are we talking about? We're talking about one called the Black scale or something mental scales. These can be done or used on those residents that are perhaps in a vegetative state. They had maybe a cognitive impairment with Alzheimer's, dementia. You will have to utilize whatever your facility has instructed you to use. So it's important that you evaluate pain, okay, along with your other vital signs. It's very important because it affects all your entire body systems. So this is the last of the vital signs. Again, please make sure that you review and utilize these vital signs because they do dictate the treatment of the patient or the resident, depending on the facility, dictate the care plan, and so on. So please make sure that you feel confident and competent about performing vital signs on residents. Please do not refer to as taking vital signs. You're not taking anything from them. All you're doing is measuring vital signs. So when you present yourself to the patient and you explain to them, please tell them that you're going to measure their vital signs because that is what you're doing. Again, please go ahead and go watch the videos on how to perform each vital sign and practice it because they will be part of your certification exam. We'll see you on the next section, which will be talking about the measuring weight and height. Hello, hi, we continue our conversation about vital signs, and one of the baseline measurements that we're going to be performing is measuring the weight and the height. Now, there's different ways of going about this, but for most residents, they're able to stand and they're able to walk on their own. They're able to balance on a scale. Using one of these numerical scales is one of the most common and easiest ways to perform a weight measurement. You could also perform a height measurement on one of these using a height measurement device or attachment that is located here in the back side of it. So one of the things that you have to remember is why do we have to weigh the patients and is their height and weight? Well, because again, this is baseline information that we need to gather when we first uh, admit the residents into the facility. It helps us establish a baseline weight. So a month from now, you're going to be weighing the residents once again, and you're able to determine if this resident has increased or lost weight. It is state rules and regulations that we have to make sure that we keep a log because a lot of times these residents will fall into complications or they will digress and lose weight. They will stop eating or slow down their eating, cut their eating to a point where they will be possibly hospitalized. And we try to prevent hospitalizations in long-term care facilities by simply measuring their weight. You can tell when a resident is losing weight when you start measuring their intake. If you notice that on a daily basis, they're eating less and less and less, and when the 1 month comes around and you weigh them and you notice they lost several weights, this is called unintended weight loss, and it could be considered a deficiency if it is not uh, taken into account. So we have to do something. Once we identify problems such as weight loss, we have to take measures. So it is very important that we learn how to weigh patients, residents in a timely manner, perhaps every month or every other week if it's needed. So we're going to be weighing patients again, usually once a month in a long-term care facility. Why? Again, because we want to keep track of any loss of unintended weight. Okay, so we measure in the United States. We measure in pounds. Okay, everything that we do is in pounds. This scale has uh, measurements in pounds. One of the things that you must remember is that when you're going to weigh a patient on one of these standing scales, you must ensure their safety. Please make sure that they're able to stand and balance on their own, even for a few seconds or a minute. If you don't ensure that, then the patient may fall, and that could be considered neglect. Okay, you should be able to make that judgment. If not, they may require some other form of measuring their weight. Some residents will be weighed in a wheelchair scale. Some residents can also be weighed on a device which is called the lift that also functions as a scale for those residents that cannot sit or stand. They're completely bedridden. Okay, so there's several ways to perform a measurement. The key thing here is that when you're going to perform a measurement on a scale, you must be able to you must ensure that you zero out the scale. In this case, we have a mechanical scale. When you're going to use it, okay, you must ensure before the resident steps on the scale that you move all the weights to the left side and that the beam of the scale is in balance. It must be right in the middle, okay? This tells you that the measurement will be accurate. If it's a digital scale, most scales have a button that says 0. You must press this button before you sit the patient or stand the patient on the scale. If you fail to do so, this will give you an inaccurate reading. What this does is that when you press the 0, the electronic scales will automatically correct themselves, okay? They recalibrate themselves, and then you can put the patients on the scale, either be a standing digital scale or a wheelchair scale, okay? Or even the bed scales. Those scales must be zeroed out before you perform the actual measurement, okay? Now, again, this measurement is very useful from the very beginning so that we can see the progress or lack of progress in some residents or patients, okay? So we also have to perform a height measurement. Again, most of the time, it's not done for, to see if they're growing. Most residents are measured for pharmacy purposes for medical treatment. If they ever need an antibiotic therapy, and the pharmacist will require a height and weight measurement, a current height and weight measurement. Therefore, the doses can be prescribed according to their height and weight. So we measure height and weight in the United States in inches. Every foot has 12 inches. So if a person measures 5 feet, that means he measures 60 inches. If he measures 6 feet tall, that means he's 72 inches. So we usually express the reading as five, apostrophe, and then the inches. So 5 is a feet, and then the other number will be the inches. So if you're going to measure a resident on a standing scale, again, after you perform the weight measurement, you can also extend the height attachment, and it will be touching their head, okay? Make sure that you don't hit them with a device that flips forward. You can hit them in the face. So again, please make sure that you ensure their safety when they're on the scale. You get the measurement, and then you're going to sanitize your hands, and you're going to document that reading on a piece of paper or on a board. Now, let's say a person is unable to stand because they're physically impaired. How will you perform this? Well, you can also perform it if the person is in a wheelchair or they're in a bed. You can simply get a tape measurement and start from the head and follow the spine all the way down to the hip, and then follow the leg all the way down to the heel. This will give you a very accurate measurement of their height. So if they're in the bed, you can always move them to the head of the bed, make sure their top of their head is touching the headboard, okay? And then extend their leg if possible, make a small line, and then measure that length. If the patient has their legs contracted and they cannot extend it, again, you do the same procedure. Start from the head, follow the spine to the hip, then to the femur, to the top leg, and then to the bottom of the lower leg, all the way to the heel. This should give you an accurate measurement of the height. It is very important that you perform this upon admission. This is, again, your baseline information. It will help us to tailor the treatment of the patient according to their needs. Okay, so we are complete now with the section of the vital signs that we'll be performing, and we will continue on our next section on restraints, which is a very important topic that you must be informed about. So stay tuned. We're going to continue in just a bit.